Hi, I'm Dr. Ryan Robinson, and I'm the owner and the founder of the Pain and Sleep Therapy Center. I developed a special interest and passion for helping people sleep and get rid of their pain after a lengthy start to my career as a general dentist. As a dentist with a sizable and successful practice, I had the good fortune to see thousands of patients on a routine basis. As time progressed, I began to recognize that there were common themes that I was seeing in patients' mouths that didn't make sense to me, and that I wasn't trained to look for that could be negatively impacting my patients' oral and overall health, and potentially have an even deeper meaning behind them. Whether it was a large, wrinkled, and coated tongue, worn down teeth, or a crowded blocked throat, I was fairly certain that none of these common signs in the mouth were healthy. In dental school, we were taught to call these things variations of normal, which I conceded to during the first half of my career. Eventually, I grew tired of not knowing why these variations of normal existed, and so I had to know. I had my aha moment when everything clicked and things started to make sense when I attended a dental conference and took a breakout course on sleep apnea. Not only did everything that I was seeing in my patients' mouths begin to make sense, but it created a curiosity and burning desire inside of me to learn more. I spent the next several years traveling around the world, learning as much as I could, taking advanced continuing education and training and being mentored by some of the world's experts in this field. What I discovered was remarkable, and it gave me confirmation that all of my suspicions were true. I learned that each person's mouth tells a much deeper story about their overall health and well-being. It was then that I came to the realization that dentists are in such a unique position to screen for and identify many underlying signs and symptoms that plague a large percentage of our community. I believe that dentists should be on the front lines for identifying these risk factors because there are no other health professionals that spend an hour with their patients every 6 months, and on top of that, have the opportunity to look at and evaluate the patient's breathing hole in that same process. We now know that a majority of all systemic health conditions in the body have their earliest manifestations and signs in the mouth. So when I finally began rejecting these things as variations of normal, and I retrained myself to focus on identifying the root cause of the problem, I knew I was on the verge of something special and could help a lot of patients in more ways than I had ever imagined. As a dentist who has always been searching for something more, this was exactly the momentum and motivation I needed to dedicate myself to treating patients who needed my help. Of course, the first stop along this newly found journey of healing led me to start by helping my wife and our 2 children. My family's cases are described in detail throughout my first book publication, The Root Cause, which was written in order to educate others on the importance of the things that I have had the opportunity to learn.